Today is our first in a series called Conversations in Civic Courage, which we will be continuing on over the next few years. And today we're going to be talking with Willie about approaches to working with LGBT populations. Before we get started, just a little bit about our presenter. Willie Wilkinson is an award-winning writer and public health consultant who has worked extensively with health service providers, educational institutions, and social justice organizations to develop culturally competent service approaches for LGBT populations. Nationally recognized for his experience in transgender health issues, Willie also has extensive experience with communities of color, substance users, sex workers, youth, and people with disabilities. Willie earned a master's in public health in community health education from UC Berkeley and a BA in Women's Studies at UC Santa Cruz. As a trainer, Willie employs a welcoming, interactive, non-punishing approach that honors participants' expertise and welcomes all questions at all knowledge levels. For more information, you can visit www.williewilkinson.com, and I believe in a slide later on down the line you will have the website posted there. So now I want to hand it off to Willie. Willie, welcome.
Oh, thank you. Thank you very much for the invitation. And hello, everybody. Okay, culturally competent approaches for serving LGBT populations. And so I just wanted to note at the bottom there that the Community Alliance for Culturally and Linguistically Appropriate Services that is the grant that I'm here through. It's a large cultural competency grant funded through the Department of Alcohol and Drug Programs on the state level. So I'm able to provide free services to organizations and institutions anywhere in the state of California if that's something that you're interested in having for your organization. And we look at cultural competency within the lens of racial, ethnic, LGBT, and disability. So it's great to be here with folks on the line, so I'm interested in hearing what you have to say as we go on. So let's go to the next slide, objectives. So this is what we hope to accomplish in the next hour or so. It's a little tight time frame, but we'll do our best. So I'd like to start out with language, with defined terms, identities, and concepts associated with LGBT communities, and that's where a lot of times there's a lot of questions, and so I just want to make sure we're all on the same page about who we're talking about in relation to this population. Utilize culturally appropriate language and behavior for addressing and working with LGBT populations. And that's looking at, how to show respect to folks, the mind in your work. That will help build that rapport with folks in this population. Describe the myriad socioeconomic, health, and legal issues that LGBT people face. We'll look at some of the socioeconomic issues and healthcare access issues, legal rights of LGBT folks, and legal responsibilities of providers who serve LGBT folks in the state of California. And describe culturally appropriate systems and service approaches for working with LGBT individuals and families. And we can look at systems issues of policies and procedures need to be reevaluated to be more LGBT inclusive and so forth. And identify steps your organization can take to improve services for LGBT populations. So we're going to go to the next slide. And this is just a brief breakdown. What is LGBT? When we talk about LGBT, we're talking about lesbian, gay, bisexual, and transgender folks. A lesbian is a woman who's sexually attracted to other women. A gay man is a man who's sexually attracted to other men. A bisexual person is someone who is sexually attracted to both men and women. And transgender people have a significant cross-gender identification from the sex they were assigned at birth. So those are just real brief definitions. And then to the next slide, what is queer? A lot of times you hear the word queer. And a lot of times people in trainings ask me, is that something that I can say? Is that a word that's appropriate? And some folks have heard it as a term of pride and see that as a really positive term. So I just want to break that down a little bit. It's a commonly used term, especially in this region. When you talk about terminology, this stuff can change from block to block, community to community, and generation to generation. And so, some people in other parts of the country might not see this word resonate with this word, or might not use it in a prideful way. But certainly in the San Francisco Bay Area, a lot of people have really reclaimed this word as a word that may mean either same-sex orientation or the larger LGBTQ spectrum of identity as a unifying socio-political umbrella term. Historically, it was used in a very pejorative way to put down gay men in particular, but it got reclaimed about 20 years ago or so, and it has become a term of pride for many people. So we can go to the next slide. And as we go to questions, we certainly can respond to questions or comments that people have related to all this terminology. What I say might be different from what the next person says, and so forth. So when we talk about bisexual experience, it's a piece of this discussion that often gets left out. Bisexual people may be married or in a committed long-term relationship with a same-sex partner or opposite-sex partner. Bisexual people do experience discrimination, especially if they're in a same-sex relationship, are often mistrusted by lesbian gay people. And some of the misconceptions are that they are promiscuous, and like they're just so busy, right? That's the idea of bisexual folks, unable to commit and not loyal to LGBT community concerns. We can go to the next slide. So this brief breakdown. Okay, and now I also want to talk about gender identity and the distinction between gender identity and sexual orientation. So sexual orientation, when we talk about the LGB part of LGBT populations, we're talking about sexual orientation. It describes who you're attracted to, who you have sex with, who you love, who you create family with. Gender identity describes who you feel you are on a soul level in terms of your gender. Are you male? Are you female? Or are you something in between male and female? So that's distinct and separate from sexual orientation. And we all have a gender identity, not just transgender people. But that's the piece that we talk about when we talk about transgender experience. So we can go to the next slide. And what is transgender? So transgender people have a significant cross-gender identification from the sex they were assigned at birth. It's an umbrella term that can include many different folks who transgress gender norms by defying the expectations of family, community, and society. And of course, the social expectations of gender really vary by culture, geographic location, and generation. And so we can talk a little bit more about that when we talk about, we go to the next slide, like when we talk about gender nonconforming. What is gender nonconforming? That can be very socially and culturally based. So we're looking at this diagram, right? So this is one way of looking at it, and really not a perfect way. But one way of looking at it, if you look at it as a series of concentric circles where you have transsexual folks as part of a larger group of folks, of transgender folks, as part of a larger group of folks who might be considered gender nonconforming. And you might visualize it in different ways, but this is one way of looking at it. So we'll go to the next slide. So now the term transsexual refers to folks who are living 24/7 in a cross-gender identity that is different from the sex they were assigned at birth. Now historically, this was used in a very medicalized way by outside researchers who are not part of the transgender community. And usually describes people who accessed full medical transition, meaning hormones, or mental health therapy, hormones, and transition-related surgeries. But given that not everybody wants all those pieces to medical medical transition, and some people have been advised because of their medical condition not to pursue transition. Some people do hormones and not surgery. Some people do surgery and not hormones. Some people don't do any of that. And it's really a healthcare access issue and an economic issue in terms of access. So that term has really evolved to describe anybody who lives full-time, regardless of their biological status, their hormonal status, or surgical status. The terms below here, you see male to female, or MTF, so that means assigned male at birth, transition to a female identity or presentation, also known as trans women. And that's honoring that person's identity rather than their original biological status. and then conversely, female to male individuals, people assigned female at birth, transition to a male identity and presentation, also known as trans man. So we can go to the next slide. And again, after we finish this piece on transgender folks, I will stop so we can have questions. I know there's often a lot of questions on this issue, and that's why I'm spending a little more time on transgender folks, because that's a lot of times where there are questions and where there are challenges that come up in service provision. Okay, so I already talked about the term. And then transition describes the process by which a person changes their gender expression to something other than the sex assigned at birth. So now transition can involve the medical procedures I described, hormones, surgeries, and so forth, and we'll go into that in more detail, as well as social practices, how people dress, present themselves, how they have their hair, and so forth. Transition can take years and varies depending on the individual's preferences, finances, health status, and healthcare access. Okay, so we can go to the next piece. So this is a breakdown of what that might look like, male to female medical transition. Male to female individuals take female hormones and an anti-androgen that's to stop the effect of testosterone to develop a female appearance, including decrease in musculature, development of breasts, and development of smoother skin. The hormones don't make the voice higher or eliminate body hair. That's local training that does that. Go to the next slide. Trans women are encouraged to wait 2 years before seeking breast augmentation because the hormones will produce breasts, and so that's part of the process. And trans women may stay for years for genital surgery. Some people have traveled to Thailand. We do have a new surgeon that's moving into town and starting practice in January in San Francisco, who is going to be taking over Michael Brownstein's practice, who had provided female to male chest surgery for 30 years. He's retiring, and we do have Dr. Curtis Crane, who's coming to San Francisco, who's going to be providing female to male chest surgery, genital surgery, and male to female facial feminization, breast augmentation, and genital surgery. He's trained with all the leaders globally and is now starting to practice in San Francisco. And so that will look a little differently in San Francisco, also with Healthy San Francisco passing transition-related care as being, or transition-related surgery as being part of Healthy San Francisco. That is looking like it should be rolling out at San Francisco General if everything goes well, though the systems are not in place, and so we'll see how that may change for people. And then another piece to transition, some trans women seek electrolysis, as well as people do often inject silicone and other materials which are very dangerous for folks. A lot of times it is not, usually it's not medical grade. Somebody rolls up, does a back alley thing to create curves, and a lot of times that it can be just really, really horrible and create complications and serious health consequences. People have died from this. The stuff might be injected to create curves in the butt and then go with gravity down to the ankle and be very hard and darkened and be unable, they can't remove it and create a lot of health issues. So that's something we definitely encourage people not to access because they're not medical providers. They're people who charge people a lot of money but create problems. Okay, so we'll go to the next slide. So female to male medical transition. So trans men take testosterone to develop a male appearance, including increase in musculature, deepening of the voice, and increase in body hair. Trans men can develop male pattern balding if that's in their genetics. And FTM individuals or trans men often seek chest reconstruction surgery. So that's removal of the breast and construction of a male chest. Many forego genital surgery just because it can be highly invasive and cost prohibitive. And some, not all, can be prone to complications. So we can go to the next slide. Now I'm going back to the diagram that I showed earlier. This is just to draw the distinction between, we had transsexual as part of a larger group of folks, transgender. So going back again, transgender is an umbrella term That includes transsexual folks and others who transgress gender norms. So that might include people who might be considered cross-dressers, as in part-time, an individual who might dress part-time, usually biologically male transition, or I'm sorry, dressing in female attire part-time, but not necessarily, may not identify as transgender, may not be interested in transitioning to a full-time female identity. A genderqueer individuals. And people who do drag might be considered transgender or maybe not. Maybe just gender nonconforming or people who play with gender. It really depends on the individual and how they might identify. So now genderqueer is an important concept to know, especially if you work with young people. But just that there are a lot of people who are starting to identify as genderqueer. There's a real burgeoning movement of folks. Now genderqueer describes people whose gender identity or expression does not correspond with either the sex they were assigned at birth or an exclusively male or female cross-gender identity. This term came into common use in the early 21st century in youth culture and is often used as an umbrella term to describe gender identities or expressions that are outside the gender binary. And what we mean by that is gender binary is this idea that there are just two genders. You know, you're born male, you have male genitalia, there's a certain set of expectations about masculinity. You know, you better be rough and tumble and love the color blue. You know, if you're born female, you know, people throw pink toys at you and you better like dolls and dresses. You know, this idea of these extreme binary gender. But you know, this idea of pink and blue is one thing, but it's an idea that there are only two genders. And people who are identifying as genderqueer are saying that their gender is somewhere located between male and female or beyond male and female. So I can make your head spin with that. We'll come back to that. And if you have questions, we can talk about that. Gender nonconforming individuals. Now this is also people who might be genderqueer might be in this range of gender nonconforming. Gender nonconforming individuals have a gender expression that differs from widely accepted and prescribed gender expectations. So genderqueer people might locate themselves as gender nonconforming but not consider themselves transgender, but may feel that their gender is different from what's expected of society. Gender variant or gender nonconforming people, gender nonconforming individuals can include masculine females and feminine males and people who do not identify as LGBT. If you look around your world, you know, you can see there's a lot of people who might be considered gender nonconforming. And really that's very socially and culturally based. You know, what is gender nonconforming in one society or culture might not be gender nonconforming in another. So, okay, at this point, as I ran through those terms pretty quickly, I want to pause here and just open up the floor for questions.
So if you have questions for Willie, go ahead and press *6 to unmute your phone, or you can raise your hand on the Illuminate system or write a question in the chat box.
Are there any write-in questions or folks on the line at all?
I guess everyone's getting this.
So you don't have any write-in questions on the webinar?
No, we don't.
Oh, okay. I mean, you know, I do. What's that?
We have quite a few people.
I do live interactive. Quite a few people on here. Okay, I do live interactive training. There are always questions. I never have a training where there are not questions about this stuff. I know you all have questions, but you know, I ran through it pretty quickly to allow some time for it. There's a lot of complexity when you break this down in terms of identity. And also, if there are any terms that you've heard that you have questions about, you know, feel free to put that out there as well.
We do have a question now, Willie. Someone has typed into the chat box, do we have to be particularly sensitive to the needs and wants of the transgender people? So I think they're asking about particular areas of sensitivity.
Okay. I'm going to ask you, whoever asked that question, can you say more about what you mean by that?
This person is a therapist, I think. So it says as a therapist. I'll just type in, can you be more specific?
Can you say more about what you mean by be sensitive to transgender populations? I mean, we can talk about what that means in service provision, in terms of intake process, forms, questions that get asked. We can talk about gender-specific environments and what that means in terms of access. But I'm wondering what you mean. Are you talking about issues that people, you know, what sort of sensitivity are you talking about? Are you talking about mental health issues, or what do you mean by sensitive to transgender populations? So again, Ted, I can't see it. So is there a response, or is someone responding, or can you tell?
Really, this is Rosemary. It's the question from Linda when Ted asked, can you be more specific about sensitive to trans populations? Linda's response was, I have one client who is trans, and he or she was asking if I knew exactly what he needs as a trans person, confusing her, and then she responded with mental health issues.
Right. Well, you know, as we look at the many different issues that people face, you know, people have experienced multiple incidences of discrimination. LGBT people have. Transgender people certainly have. There might be issues of lack of family acceptance. And issues that come up with lack of family acceptance might mean that people have struggled to survive, are dealing with low socioeconomic status, difficulty accessing housing and employment. There's a whole range of issues that might occur if the person feels that they cannot live authentically. If they are considering transition, you know, if that's the right thing for them, what consequences there might be there. Or if they have transitioned, if they are not perceived as the gender that they identify with, there's a whole bunch of issues that can arise there in terms of discrimination, access to employment, and so forth. So, I mean, there's so many issues that we can talk about there in terms of, you know, what those mental issues might look like. There's the stress of discrimination. There's the stress of, you know, being told that you're wrong your whole life. You know, the shame, the fact that we have the gender identity diagnosis in the DSM, which continues to be there. So the DSM-5 is coming out in 2013. It's going to be gender dysphoria related to the stress of that discrimination, but it's still in the DSM, whereas homosexuality was taken out of the DSM in 1973. And so, you know, there's just so many issues. I would recommend that you go to Injustice at Every Turn, which is and I have a handout with resources. If you get the handout, it's in there. National Center for Transgender Equality did a very large-scale study of the transgender population nationwide, 6,450 participants, and 41% of the respondents had attempted suicide, which is 25 times the general population of, I think, 1.6% for the general population. So, you know, certainly there are many mental health issues associated with transgender status and or gender nonconforming status and or visual nonconforming status. They did in that study they did distinguish between people who might be considered visually nonconforming and the stress that brings for them as well. So I don't know if that was where you're going with that question, but that's some of the issues that come up in terms of mental health status. Do you want? Does the questioner want to respond, or anybody else want to ask a question?
Thank you. Thank you for going into depth in that particular question. We have another question from the chat box, which is, can you explain the term transvestite?
Okay, good question. So transvestite is considered an older term, and by many people in the community is considered outdated and inappropriate at this point in time, although there may be some people, particularly older individuals, who may use that term to describe themselves. And some Spanish speakers as well may use that term to describe themselves in Spanish. So it's not completely out of use within the community, but it's generally considered to be a term that's used by people outside of the community about people who, if you speak Spanish, if you break it down, trans is cross, vest is to dress. So literally, or technically, it means cross-dress or cross-dresser. And so a lot of times it's used to describe someone who others perceive to be cross-dressing, as in that that person is a male to female individual who's biologically male, who's wearing female attire. Now, while there are people who would call themselves cross-dressers, who might not have a strong female identity but wear female attire some of the time, there are individuals who are transgender who are male to female individuals who have a very strong female identity. And so when they get labeled as transvestites, for them it's about what's in their head, it's about what's between their ears and how they identify, not just the attire that they're wearing. And so for that reason, it's considered pejorative by people because it's more than the clothing. For a lot of individuals, it's how they feel that they are, that their identity is. I hope you can follow me on where I'm going with that. But so I would say definitely it's a term you would want to exercise caution around, since not a lot of people do not resonate with that term. So the term transgender or trans is considered a term that's appropriate as a broader term that is more all-encompassing of individuals who have a significant cross-gender identification. Hope that answers your question. Feel free to hit back if there's more.
Willie, the person said thank you, and then they followed up with, but I think maybe you answered it. They said, is it considered an insult? Was the follow-up question.
Okay, good question. Good question. Yeah, I think amongst many people in the community, it might be considered an insult. You know, again, there are some people, especially older generation folks, who might not read it that way, but many people might. So that's why I say you would exercise caution around that term. Any other questions before we move on? Okay, so I'm going to go on here, and then feel free to jump in if you have other questions that arise. Okay, so let's go to the next slide. Socioeconomic issues. Are we there, Ted?
Yes, we're there.
All set?
Yep.
Okay, excellent. Thank you. Okay, so now, and this is just a rundown again. Many LGBT people struggle with heightened survival issues.
Willie? If I could just
yes?
interject for one moment here. We do have a note that you might want to just slow down just a little bit and maybe speak up if you can a little bit so the captioner can get all the words that you're saying.
Oh, okay. Yeah, I know I am speaking very quickly. Sorry about that. I have a lot of material and I'm trying to fit it in within this time frame. So,
okay, thank you.
And for the captioner, a lot of what I am saying is, a lot of what I'm doing is reading what is on the screen. But yeah, I understand you're trying to catch everything there, so sorry about that. So again, we're talking about some of the socioeconomic issues that LGBT people face, discrimination in employment, housing, healthcare, public accommodations, and social services. And we'll talk more about what that looks like, particularly around services, health and social services. Public humiliation, harassment, and ridicule, being kicked out of their homes, or otherwise isolated from family relations. This should say LGBT status, sorry. And, many people, LGBT young people, get kicked out of their homes, have no place to go, wind up in San Francisco, have to struggle to survive on the streets, in whatever way that they can, and have difficulty finishing their education, and difficulty in a number of ways because of lack of family acceptance. There's a program called the Family Acceptance Project out of San Francisco State University that has some really interesting, very compelling data about, and it's very clear the difference between folks who have family acceptance and folks who have been rejected by their families in terms of mental health status, substance abuse, education, employment, and so forth. So limited access to education. A lot of times people have been harassed and bullied in school, and that's made it difficult for them to be able to complete their education. Hate violence, certainly we lose many people every year to hate violence. Abusive treatment by law enforcement personnel, discrimination compounded by racism, classism, sexism, ableism, and other oppressions. So, clearly people's LGBT status is not the only part of, what's making life difficult for them as well, or the only identity that they have. So let's go to the next slide. So also a quick rundown, and certainly not a comprehensive list, but health issues, HIV and AIDS, cancer, substance abuse, mental health. And we talked about suicide in the transgender population specifically, but we've also certainly seen many LGBT young people commit suicide, particularly gay men or gay boys. There was some media around suicide about a couple years ago about all these young people we were losing to suicide. The overwhelming majority of them were young gay boys, 11, 12, 13, and on up. Just the pressures of masculinity and the difficulties people are experiencing, especially if they are not accepted by their families. Reliance on commercial sex work for survival, like a lot of young people who end up on the streets are struggling to survive through sex work, particularly gay men and particularly male to female transgender individuals. Difficulty accessing health care and public health services that are culturally competent. That's where people may walk into services and get looked up and down, or providers don't know what questions to ask, how to ask them appropriately to understand what their LGBT experience is. Difficulty obtaining health insurance for a same-sex partner. Difficulty being able to visit a same-sex partner in a healthcare setting, and difficulty obtaining health insurance and getting coverage for transgender care and services. And we'll talk about that a little bit more later. So going to the next slide. Oh, and this is that slide. Transgender. So talking more about the transgender health insurance issues. And again, with Healthy San Francisco passing this landmark decision, as well as the city and county of San Francisco passing the landmark decision back in 2002 to provide transition-related care. We do have more access here than anywhere else in the country, but at the same time there continues to be healthcare access issues. So many transgender people have their applications for health insurance denied when they disclose their transgender status or transition-related medical history. So most common when applying for a private health insurance plan, but also happens when applying for employer-based or other group plans. And most insurance policies, there has been some improvement on this. This continues to this day that they specifically exclude transition-related care and services. So again, we're talking about hormone therapy, transition-related surgery, and gender identity-related mental health services. So Medi-Cal covers mental health therapy and hormone therapy. And since the year 2000, they do approve transition-related surgery, but you can't find a provider in the state of California who will perform transition-related surgery for Medi-Cal rates. In recent years, there have been some individuals who have been able to go out of state for care and have that covered by Medi-Cal, but there are still very few people who have been able to access that benefit. So going to the next slide, healthcare access. Many LGBT people have had multiple negative experiences in public health, healthcare, and social service settings because of insensitivity on the part of providers and office staff. So people might be coming to you having experienced many instances of discrimination. So discrimination in health-related settings causes LGBT people to delay or avoid necessary services, whether it's substance abuse, treatment, counseling, medical care, etc. And that can often have severe consequences, health consequences. So culturally competent services improve quality care and treatment outcomes. So going to the next piece, this is on how to show respect. And this is really, in whatever work that you might be doing. So providing services, working with individuals in whatever way. In terms of with the population, you treat folks like you want to be treated, right? By being relaxed and courteous, avoiding negative facial reactions. One thing that comes up is exhibit a professional comfort level with LGBT individuals and families. Normalize LGBT experience by acknowledging different family structures and using appropriate language, such as the word partner. I think a lot of times people have difficulty asking about that significant person in someone's life, and they might say, so how's your friend? Or something. Sometimes people experience some awkwardness around that and feel uncomfortable. And this is an individual that someone is sharing their life with for 10 years or something. So a term partner, it's good to be able to be comfortable with the term partner. But that's a term that, is not used exclusively by LGBT folks, but it's a use that's generally acknowledged in the community to describe that significant person. You don't make assumptions about a client's sexual orientation, gender identity, or relationship status. Keep the focus on care and services rather than indulging in questions out of curiosity, as long as it's relevant. The questions are relevant, right? Never disclose a person's LGBT status to anyone who does not need the information for care and services. So confidentiality is really, really important. Going to the next slide. Excuse me. So in terms of working with transgender folks, it's important to remember to use the appropriate name and pronoun, even if you're not in the person's presence. She for transgender women and he for transgender men. Now, a lot of times you have a situation where you're not sure what's appropriate. And while it can be awkward, I do encourage people to ask politely for clarification. If you're unsure about how to address or refer to someone, you can say, how would you like me to refer to you? What pronoun is appropriate? How would you like to be addressed? And those are options. It's good to be able to, to know for sure, because you cannot repeat somebody's name indefinitely. At a certain point, you're going to need a pronoun. But also, it's good to know at an organizational level to have that documented if you're working with folks, so that that person doesn't get asked repeatedly, but that you know how that person would like to be addressed. A lot of times people apply for services, they feel they have to use their legal name, but in fact they have a preferred name. It's good to know that information. It's inappropriate to ask about genital status if it's unrelated to service provision. Like the transgender person goes to the dentist and gets asked about their genital status. Wrong location. Genital status is not a determinant of gender. Gender identity is what's between the ears, not what's between the legs. So in terms of rights for transgender folks, people have the right to access services based on their gender identity and expression, which is about their identity, regardless of whether or not they've had genital surgery or if they've legally changed their name and gender. And we'll talk about that more in a minute. I want to pause here and see if there's any questions about any of this material.
So, Willie, this is Ted, and we had one question that was typed into the box while you were speaking. I think you may have hit on it, however, you might want to expound on it a little bit more. And that is, if an individual does not offer how they identify, what are some ways in a sensitive and culturally appropriate way to ask for their preferred pronoun?
Okay. Yeah, good question. Well, one way you can do it is have it on your intake form if you're doing an intake process, so that, and if it's something that is on the form, whether the person fills it out or you ask the questions, there's consistency there and everybody gets asked the same question. And the more you have consistently, the less likely you create a discriminatory environment. So that's one way to do it. If you're in a social interaction or you're engaged in work in some way with the individual and it's unclear, I encourage people to just let people know you're coming from the heart. I'd like to be respectful. How would you like me to refer to you? Or, what pronoun is appropriate? I like the expression, what pronoun is appropriate, rather than what pronoun do you prefer. Kind of like the term sexual preference went out way back in the 70s or whatever, a long time ago. It's not a preference, one of those. It's really an identity, a sexual orientation. And the same with pronoun. I think it's what pronoun is appropriate rather than what pronoun do you prefer. For a lot of people, it's not a preference. It's what is authentic to their identity. So, you can say what pronoun is appropriate or how would you like me to refer to you. Granted, there's no easy handbook on this. It's never a perfect situation. You have to use your judgment on how you think would be the best way to approach the individual. It's possible that person could be offended, but as I talk to many people about this issue in whatever service provision they're providing, a lot of times, or social interactions they may be engaged in, people say that most of the time the individuals are happy that they were asked. But at the same time, it's possible that the individual may say, well, why are you asking me that question? Isn't it obvious? Or something along those lines. And so, I think you just want to let people know you're just trying to do the right thing and you're coming from the heart. And so, do it your way. show them that you're just trying to do the right thing. I think that's what I can say there. I hope that answers your question.
So I have a follow-up question, Willie, that's kind of along the same line.
Sure.
Taking that same thing not just to trans folks, but really to anyone who's LGBT, and what's the appropriate way to ask about how someone identifies? Because when I came out a long time ago, it was you were gay, and then it was gay and lesbian,
right.
and then it was lesbian and gay and bi and trans and now there's queer and genderqueer and all sorts of stuff. So what's the appropriate way to open that conversation?
What's the appropriate way to, talk about LGBTQ status in some way?
Yeah, and to ask someone how they identify.
Yeah, I guess it really depends on the situation. I'm a dinosaur myself. I remember people would say, oh, are you family? Are you a friend of Dorothy? That's going way back. I think I'm not as old as people saying, are you a friend of Dorothy? But, that was one of the things people said. Or people used to say, is that person family or are you family? That was an 80s term. Now I think it's like people will just say, oh, how do you identify? Just like you're saying, how do you identify in terms of, I guess you're asking, how do you identify your sexual orientation or your gender identity, right? Again, identity might be different from behavior, and we certainly learned that with the HIV/AIDS epidemic. It's not necessarily how people identify; it's really what their life is about. So it might be a question about their relationship status. Are you in a relationship? And if they don't say anything about the, if they don't use a pronoun or something, is that person a man or a woman? That sometimes those kinds of questions get asked. I guess it really depends on the context. What sort of context are we talking about here? Is it relevant for work you're doing, or are you talking about a social interaction? You know what I'm saying?
I think really in both. Because in a lot of times there's an age difference, between people who are gravitate towards, terms of identity that can be very generational. I can tell you in the world of disability in the office and everything, the word family is still used a lot, even though I do remember it from the 80s. It's still used quite frequently, and I will come across folks who, in asking me, might have, are you gay, queer, that whole thing, and then even asking, some people will be really cool about asking, how does your boyfriend or partner prefer to be referred to? So people are even a little bit, and to be perfectly honest, in a professional situation, I will refer to him as my partner, although it kind of ticks him off a little bit because he's my boyfriend. But I do that to blend in because everyone else does. So I was asking kind of along those lines.
Right, and a lot of times, I think that's the thing, is that people use different terms. They might use boyfriend, girlfriend, wife and husband, or whatever to describe that person, not always partner, which can seem more clinical or, cold in some ways, and not everybody resonates with that term. But yeah, I think it sounds like, you're talking about, it comes up in various different ways. And a lot of times it comes up in more of the actual description of, your life, who, that significant person that you live with, rather than how do you identify, right? Although sometimes it does, come up in terms of like, identify as queer or identify as gay or whatever. Okay. Well, anyway, did you have more to say about that?
No, actually, we do have 25 minutes left, so I just kind of wanted to move us along, if that's possible.
Sure. All right. Are there any other questions before we move on?
There's none here in the chat box. Anyone on the telephone line?
Okay. Well, feel free to send in questions as they arise. So I want to go to the next one, which is on legal rights of people in same-sex relationships. And we just have a few more slides before we can open it up more to questions. So in the state of California, people in same-sex relationships can obtain a domestic partnership, which provides most of the rights of marriage. Domestic partnership provides state rights, but not federal rights. So Social Security, IRS, immigration, those are federal issues. And we're hearing about that, being discussed more and more now. Same-sex couples who married during that special window between June 16th, 2008 and November 4th, 2008 remain legally married. So we have this odd tier now where we have 18,000 same-sex couples who are legally married in the state of California and others who cannot currently. Same-sex couples in domestic partnerships and marriages have the right to hospital visitation, medical decision-making, access to family health insurance plans and other spousal insurance policies, and sick care and family leave. And I'm going to go to the next one, which is legal rights of transgender individuals. So in the state of California, people have the right to receive services based on their gender identity and expression, which may be different from their biological status, or the name and the gender on their ID. Now, this was something that we had coverage, non-discrimination coverage, since the 70s, but the language was very unclear with the Unruh Civil Rights Act of the 70s. So recently, the Gender Non-Discrimination Act Gender Identity Non-Discrimination Act was passed and signed and became effective in the beginning of 2012. And that very explicitly states that people have the right, based on very specific language on gender identity and expression. And that means in all public accommodations, which might be health services or social services, and in any situation that is, for instance, gender-specific services. So transgender people have the right to access gender-specific services that correspond with their gender identity. So that means restroom access, locker room access, support groups, residential treatment, anything that's gender-specific. And that can certainly present challenges in service provision. If people who are non-transgender are confused or feeling upset by the presence of a transgender individual. So sometimes there's client education that needs to happen without and breaking any confidentiality of the transgender individual, but that the transgender individual does have the right to access services based on their gender identity and expression. Again, which may be, which has nothing to do with their genital status or the legal gender on their ID. People can legally change their name and gender. There's resources in the handout I sent on Transgender Law Center, which is a San Francisco organization, which is a statewide organization based in San Francisco. Has some really good, useful information online for people who need to change their name and gender legally. Okay, and I have a couple more slides and then we'll open it up again. So creating going to the next one, creating a non-discriminatory environment. Maintain confidentiality, absolutely. Again, we talked about that earlier. Demonstrate consistency in service delivery. Again, you know, if you ask some people some questions and other people not, sometimes, you know, depending on the situation, that can create a discriminatory environment. So the more you can have consistency, the more you ask everyone the same questions, the better. Be respectful in all communications with clients and their families. Demonstrate comfort with name, pronoun, and family relationships. Address transphobic and homophobic comments from staff and clients. And so I think I have one more slide here, or a couple more. Develop LGBT inclusive systems, policies, and procedures. Now, that might be having a clear policy about gender-specific settings such as support group and so forth. You know, that could be intake forms, uptake intake forms to be inclusive of LGBT experience, making sure that there are questions about relationship status that do not make assumptions of heterosexuality, and there can be questions about gender that provide for more breadth of identity. And that's the kind of work that I do a lot of times with organizations, is help them update their intake forms. Adopt a non-discrimination policy that includes both sexual orientation and gender identity, and have a system for addressing inappropriate conduct. Provide opportunities for LGBT cultural competency training for all staff, board members, volunteers, etc. And another thing is building effective partnerships with LGBT communities and referrals. Know who is also providing services to this population so that you know how to make appropriate referrals. Let's see, the last slide. Thank you. So by educating yourself about LGBT people and demonstrating respectful, culturally competent practice, you're providing vital services for a tremendously underserved population. And then the slide after that, again, I can provide free customized training and technical assistance for your organization. You know, feel free to contact me if you'd like to have a live interactive training for your group. So I'd like to open it up to other questions. I welcome your questions on any of these topics we've covered, whether it's back to terms or if you want to talk about systems issues on an organizational level, what you know, to keep in mind in terms of the work setting.
Great, thank you, Willie. So the first question that we have from the chat box right now is, are private membership groups like the Boy Scouts exempt, like in disability rights? And I think they're referring to exempt from all the legal protections that you went over earlier.
Exempt from these legal protections. You know, that is a good question. For some reason, they continue to discriminate, and they have, well, they came out in July with a statement that said that they continue to gay Scout members. If anybody is gay, you know, they're basically saying that on a national level, they are discriminating against gay participants. You know, certainly it seems problematic that on a state level we should be able to address that if we have these protections on a state level in our jurisdiction. But for whatever reason, because they're a national organization, they're continuing to do this. Although I know that there are certainly local chapters who have are adamantly in disagreement with that policy. and are certainly opening the doors to all kinds of folks who want to participate. But yeah, that is a good question, and I don't know why that continues to persist, and I think that that's problematic.
What about specifically regarding gender identity in California? Would private organizations be allowed to, because they are private membership organizations, would they be allowed to not adhere to the protections afforded to trans people under California's gender identity and expression laws?
So, private organization meaning what type of organization?
Like a membership organization, something like the Boy Scouts.
Oh, a membership organization. Well, it's my understanding that that they would not be exempt from those protections, because that law covers public accommodations, which can be considered a number of things, anything where there are goods or services. So my understanding is that they would be in violation of the law if they discriminated against somebody based on gender identity and expression. And also, for those kinds of legal questions, Transgender Law Center, transgenderlawcenter.org, great information, great people to ask those kinds of legal questions. Also, National Center for Lesbian Rights, and that's in the handout I gave you guys, nclrights.org. And that's good for those types of legal questions. But my understanding is, based on these protections, somebody would not be, it could not be discriminated in a membership organization like that based on gender identity in the state of California.
Great, thank you for that answer. We have another question,
Sure.
And the question is, what are the statistics for those looking for employment opportunities? In certain applications, they ask for applicant sex, such as male and female.
Okay. Well, I recently I've been working with the Transgender Economic. Are you talking about? I guess you're talking specifically on transgender issues, right? I recently worked with the
I'll
Transgender
ask for some
Economic.
specificity.
What's that?
I'll ask for a little more specificity. I'll ask for them to be a little more specific, but go ahead.
Okay. Yeah, so recently I worked with the Transgender Economic Power, which is a program out of the San Francisco LGBT Center to provide a pre-vocational workshop series for transgender and genderqueer identified individuals who are returning to the workforce, and marginalized individuals, many of whom were homeless or marginally housed. And so a lot of people are concerned about this in terms of employment. It's very difficult. People are not perceived as the gender that they identify with. And people have experienced discrimination. Like, we had one participant who said, she applied, and the person who interviewed her said, "Oh, we like you, but you have an Adam's apple, and we don't like that. It doesn't go with our look." And what she said was, "Oh my God, this is just outright discrimination in the employment process." Looking at, another piece of it is that a lot of times transgender people, they're asking, well, when do I have to disclose that I'm transgender? And the reality is, you do not have to disclose that you're transgender. So if you look at, let's see, Transgender Law Center did a study of transgender folks in the state of California. And this was a much smaller study than the National Center for Transgender Equality, but there was within this study, and this was a higher access and a lot of internet access with this study. 46% were employed full-time, 15% were employed part-time, 14% unemployed, 9% student, 8% disability. So anyway, it doesn't really say the whole story, but the question that when you ask about statistics, are you asking for statistics on how many people have experienced discrimination when trying to get a job, or how many people have experienced discrimination being fired from their job for transitioning on the job, or what what do you mean by statistics?
I think that the question was for the hiring process, although it would be very interested, I think most people would be very interested to hear maybe some of those statistics about both, what are the statistics around someone attempting to get a job, and then what are they about a person once they have the job and they're transitioning while they're employed.
So in the large-scale study that the National Center for Transgender Equality did, with 6,456 respondents. The respondents lived in extreme poverty. The respondents were nearly 4 times more likely to have a household income of less than $10,000 a year compared to the general population. Let's see. I thought I had some specific data. Okay, so people lost. It said that in terms of, well, this was within. In terms of when we were talking about suicide rates, they were saying that it was a staggering 41% of respondents have reported attempting suicide, but then the rates rise for those who lost a job due to bias, 55%. I don't have specific stats on how many people were fired based on their job because they transitioned on the job, but that might be in this. It's a large study, so there were a lot of different statistics. I don't have that right off the top of my head, but it's certainly an ongoing concern that many people do lose their job when they transition, and many people do have difficulty just getting employment because of their transgender status. Whether it's because they're visually non-conforming or because the employer discovers they're transgender in the hiring process in some way, because they call a past employer or something on their resume doesn't match or something like that.
And I would think that trans people, as well as other people in the LGBT community, as well as the stories of the lives of many other folks in communities where they can experience marginalization, we might not have the full breadth of statistics and study, because it really takes a person coming forward and sharing their story with some type of researcher. And sometimes people aren't ready to share their story or share their experiences.
Yeah, so in this study that was done by the Transgender Law Center, this one that was a California-based study, says almost half of the surveyed population reports that they had experienced some loss of employment either directly as a result of their gender identity or as a possible result of their gender identity. It also said over half of those respondents who have been unemployed due to their gender identity are now employed in a different field than prior to identifying as transgender or gender nonconforming. So, and less than half of respondents were employed full time. So, anyway, yeah, there's certainly a lot of workplace discrimination and harassment. 27% experienced verbal harassment on the job. That's high. 22% experienced unfair scrutiny and/or discipline. 22% were harassed by coworkers, and 17% were harassed by their supervisors. That's pretty high incidence of harassment and discrimination. So, okay, thank you for that question. Do we have other questions?
Is there anyone on the telephone line that would like to ask a question? You just have to press *6 to unmute your phone. or folks can type questions into the chat box. Thank you for the questions that we've gotten already. No, I think that's probably it. Are there any closing thoughts that you have, Willie, that you'd like to leave everyone with, in addition to, obviously, folks can see on the screen your contact information if they would like to contact you about having an in-person training at their office. Are there any thoughts that you'd like to leave us with? Actually, there is one question. So if Derek could go ahead and type the question or speak it. Derek, do you want to go ahead and ask your question?
Hello, can I talk? Oh.
Yep.
Yeah,
yep.
This is me faster than typing. This is Derek, my LRCSF out here in San Francisco, and just wanted to ask for us disability advocates around the state, either if it's our first time interacting with the LGBT community groups nearby us, or if you've been interacting with them for years, what tips would you give to us as far as when reaching out and to the LGBT community groups, as well as personally when we come across LGBT members who identify themselves as having a disability, and striking up that conversation as far as people who are two different groups that are working on the same page or are working in similar fashions, or what tips would you give us to strike that conversation?
You mean so when you're doing work together and advocacy and so forth? Is that what you're saying?
Yeah, I guess more from the standpoint of a person who's been a strong, long-time supporter of the LGBT community, who also has a disability, yet never looked at the disability community as well, and trying to strike and frame that conversation.
So you're talking about in terms of the work that you're doing, in terms of doing advocacy, or just trying to draw linkages between the issues?
A little bit of both, actually.
Yeah, I mean, I think certainly, when you look at these different populations, I mean, what I see happening in the disability community and in the LGBT community is people talking about the right of self-determination. I mean, historically, the disability community has been so medicalized. The independent living model, is really about we have the right to say who we are and what we need. And I really think that I see that so much in the LGBT community as well. That, in some ways, LGBT folks, in particular trans folks, have been infantilized, treated as not knowing who we are or what we need. And so I see that, there being linkages there, that we've been engaged in the struggle to be seen as full human beings, LGBT folks and people with disabilities, to be seen as equals, as capable of full participation in society. To have all the same rights and privileges. And so I see a lot of linkages there. And interestingly enough, I mean, more and more people are talking about that. For whatever reasons, people had asked me to speak about these linkages about transgender issues and disability issues at Stanford, UC Berkeley, and whatever. People are starting to talk about that more and more, and I love that, because I think, for so many years there wasn't that connection being drawn. People weren't talking about that. But there's, I think, also when you look at legal issues too, there's lots of linkages as well too, in terms of the laws that have been used to, used against LGBT and people with disabilities, as well as the ways that we've worked for civil rights and, in that self-determination, worked for our rights. So I hope that answers your question.
It does. Thank you very much.
All right. So any other questions before we wrap up?
I think we have time for one more, and then we'll have to wrap up. Are there any other questions? Okay, well, thank you very much, everyone. Willie, I want to thank you, and I think that the material that you covered today was really, really wonderful and important for our network as we look at different communities that we're going to be doing outreach with and working alongside over the next year. Especially the topics touched on Derek's final question, because oftentimes we do find that there is a lot of crossover between the disability community and the LGBT community. And for some of those folks, coming out on both sides is just a natural thing. And for some, they gravitate towards one or the other. And so, you know, we have to work to bring the communities together a little bit harder with some people so that they can see that both can be mutually satisfying and organizing within yourself. So very, very excited about today. Thank you very much. And I want to remind everyone that there is a survey. Because we did have to reassign this room, if the survey does not come up when you exit out of this webinar room, I'm putting the link for the survey in the chat box right now. The surveys are incredibly helpful to us, and I really hope that you will take a moment to take the survey. And with that, I want to say thank you very much, Willie, and have a great holiday.
All right,
and thanks, everyone.